Welcome back. We're at the Bebout Veterinary Medical Center, and I'm with Dr. Brandon Bebout, and we're talking pretty teeth this morning. Good morning.
How's it going?
It's going great. Okay, so when we're talking dental, what are we talking about?
So dental cleaning today here at the hospital, and so yearly for some dogs, larger breeds, again, longer snout, have more surface area, and so they're less likely to accumulate that tartar. We got a little friend here, Ginger, so little dog, she's 4 years old. 80% of dogs that are really under 25 pounds have periodontal disease to the point where they need a dental cleaning. Ginger would be the exception, and we're going to talk about that next week, about some of the oral at-home health care that we can do. But when we talk dental, we think clean the teeth. But really it's what we call a COHAT, so complete oral health assessment and treatment.
Okay.
And so it's much more than, and everybody should be going to their dentist yearly, and they say, I'm checking your lymph nodes, I'm checking for oral cancers and things like that. Well, absolutely, we're going to do that. No offense to some dogs, but they're like, I don't want you to look in the back of my throat, and so the best time to do that is during your COHAT, and so you're under anesthesia, and we can get all the looks that we want. There's lots of times where something's going on in the mouth and we do sedated oral exams. And so that's just something, that's the first part of that dental cleaning is, what does your pre-anesthetic blood work look like? And then beyond the teeth, what else is going on in that mouth?
So how long does an exam like that take then?
So, we do kind of do pre-dental examination, obviously, to recommend that dental cleaning, looking at those teeth, looking for resorptive gingiva, gingivitis, broken teeth. Very, very common tooth that we lose in dogs is this biggest tooth in the mouth, and so it's called the carnasial, and that's the fourth premolar. It's got 3 roots to it, big bad tooth that does all the chewing and whatnot, and so they're chewing on that antler or that rawhide or something hard, and so sometimes we'll see these slab fractures, and so we'll be able to see that on exam, and then we say, hey, while we're doing the dental, we're going to take an x-ray of that tooth, see if there's been any infection that's got up in there, and then deem that tooth non-vital or vital, and take that tooth if necessary. As you can kind of see on the clear model, look how much teeth is above the gum line.
Yeah.
And so, you're talking over 50% of the teeth on some of these teeth. And so we hear these, this clinic does non-anesthetic dentals. For me, not necessary, not really approved in my line of work. They do need anesthesia, so we can get up above that gum line. We can really do a COHAT, and then take x-rays as necessary. And personally speaking, I think every pet that gets a dental cleaning should get full mouth x-rays, and really should just be included. We have digital dental radiology, and so we're able to diagnose. I mean, out of 10 dogs that we take full mouth x-rays on, 7 of those dogs are going to get extra treatment.
Wow.
At least.
Wow. So to make an appointment, just give a call and get that taken care of.
Definitely, and coming up, we're going to have National Dental Month. It's February across the country, so we do a little promotional deal. So we do 10% off for those dental cleanings. That is something where, again, kind of a slower time of the year, not always, but we're just getting into the new year. Holidays are over, and then it's like, okay, what are our New Year's resolutions? Get that pre-dental screen. Again, smaller, older dogs are going to be way more likely to need that, but our Labradors, our German Shepherds, our Huskies still need it as well.
Okay, so go give a call and make an appointment, because your teeth are so vital. I mean, in humans as well.
They say it starts with the mouth for sure, and so we can tell a lot about the general health of the animal just by looking in their mouth.
Okay, thank you. Appreciate it.
Of course.
Stay with us next Monday as we bring you another edition of Pet Doc.